Hi, I'm Dr. Sharbell Hashoul, and today let's talk about something that confuses a lot of people: how radiation therapy works after breast surgery and why it's often part of the plan. First, let's clear up a common worry. Radiation after surgery does not mean the surgery failed, and it doesn't mean the cancer is more serious than expected. In many cases, it's simply a standard, well-established step that helps lower the chance of the cancer coming back in the same area. So how does it actually work? Radiation therapy uses focused energy, similar to strong targeted X-rays, to damage the DNA inside any remaining cancer cells that might be too small to see or feel. Healthy cells can usually recover from this exposure, but cancer cells are generally less able to repair themselves, so over time they die off. Think of it like this: even after surgery removes a lump, there can be scattered microscopic cells left behind in the surrounding tissue. Radiation is designed to clean up that local area. Radiation is typically considered in two main situations: after a lumpectomy, which removes just the tumor and some surrounding tissue while keeping the rest of the breast. Radiation to the whole breast is often recommended. Studies show this combination works about as well in terms of long-term survival as removing the entire breast, which is one reason lumpectomy plus radiation became such a common approach. The second situation is after a mastectomy, where the entire breast is removed. Here, radiation may still be recommended if there are certain features, like a larger tumor or cancer found in nearby lymph nodes, because there's still a chance stray cells could remain in the chest wall or nearby areas. Now, what does treatment itself look like? For most people, radiation is delivered from a machine outside the body, called external beam radiation, during short daily sessions, often 5 days a week. Depending on the specific plan, this might last anywhere from about 1 to 6 weeks. Each session itself is usually quick, often just 10 to 20 minutes, and the radiation itself is painless, similar to getting a regular X-ray, though the machine may make some noise as it moves around you. A newer option, used in select cases, is called partial breast radiation, which targets only the area right around where the tumor was removed rather than the whole breast, and can sometimes be completed in a shorter time. Whether this is appropriate depends on individual factors that your radiation oncologist will consider. As for side effects, they vary from person to person, but common ones include skin changes in the treated area, similar to a sunburn, along with fatigue that tends to build gradually over the weeks of treatment. These effects are usually temporary and improve after treatment ends, though some skin changes can take longer to fully settle. Less common, longer-term effects can include changes in breast texture or rarely effects on nearby structures, which is why your care team monitors you carefully both during and after treatment. One thing I want to emphasize: the decision about whether radiation is recommended and which type depends on many individual factors, including the size and location of the tumor, whether lymph nodes are involved, the type of surgery performed, and overall health. This is why two people with seemingly similar diagnoses might have different radiation plans. It's not inconsistency, it's personalization. Here's a practical takeaway: if radiation is recommended for you, it can help to write down your questions before meeting with the radiation oncologist. Ask about the expected schedule, what side effects are most likely for your specific plan, and what support is available, whether that's skincare recommendations or ways to manage fatigue. Understanding the reasoning behind your specific plan often makes the whole process feel less overwhelming. Radiation therapy has come a long way, becoming more precise and better tolerated over the years, and for many patients it plays an important role in reducing the risk of the cancer returning locally. As always, this video is meant to help you understand the general picture, not to guide any individual decision. Please talk with your own doctor or radiation oncology team about what applies specifically to you. Thanks for watching, and take care of yourself.